So then here's basically the stuff that's in the notes, right? So you get pain on the lateral epicondyle, you have weakness of grip. Actually, that's not the right picture for that one. It shows more medial epicondyle. Okay, so you have lateral epicondylitis on this side here, then you have medial epicondylitis will be on this side. Although terminology is not exactly accurate when you say, anytime you end in itis, it's usually inflammation, but sometimes you can have problems or pathology with the tendons without having actual inflammation, so sometimes it's called tendinosis, or medial epicondylosis, or medial epicondylopathy, something like that. So like when you say tendinitis, sometimes it's not really tendinitis, it's tendinosis, or tendinopathy. It's basically just word semantics. So then there's the special test, Mills test and Cosen's test, are those two ones that I've shown you. Okay, so now, all right, so Kermit had a rude awakening, right? And then, you've heard of the Popeye syndrome? Eat much spinach and many girls. All right, so then we're going to go over, now this is the one that I handed out today, and it should be exactly like this, so we just printed it out. There's a lot of detail on the hand and wrist, and we're going to get into some of it, but not all. So again, we talked about the two bones in the forearm. You have the wrist, the radius, and the ulnar, ulna. And then you have the carpals. Okay. Everybody all know all the names of all the carpals? Here's a couple of the different mnemonics for them. Okay. So you have in the proximal row you have the scaphoid, the lunate, and then the triquetrum and the pisiform. And then the distal row you have the trapezium, trapezoid, hamate, and capitated.
I'm sorry, do you have any more of these?
Okay, we can make some more. So like both sides of the other. Oh, yeah, we can do that. Well, we did that one thing that you handed.
Yeah, but that was just showing
okay,
the
so
radio.
yeah, we can do that first. If you want the copy of the printout on the rotate, yeah, we can do that.
Yeah, I have yeah, that was just the radiating thing. Oh, I didn't get your report. Yeah,
yeah, we didn't make copies of it. We'll do that. Okay, so these are the carpal bones right here, right? What are these? Metacarpals. And then what are these? These are those you add onto this thing. I'm not sure how to do that, but we'll see. So then you have the different joints between those. Okay, and then how many phalanges are there on one hand? Okay. Well, if there's 5 fingers, if they all had 3, it would be 15, but the thumb has how many? So 14. So then we have the radial carpal joint, okay, and then that's the ellipsoid joint, right? It has motion 2 different planes. What's this one? Flexion extension, and then what's this?
Lateral or medial.
What we call it radial and ulnar deviation. Okay. So you have motion in this plane, and then also in this plane here. Okay. And then, so there's the radius, in the elbow, the ulna makes up the majority of the elbow joint. It's the opposite in the wrist joint. The majority of it is the radial carpal, because the radial radius expands as you go distally, whereas the ulnar shrinks as you go distally. So you have the radial carpal joint, and then you have the ulnar carpal joint. Okay? This is another location where there's a disc in the body, fibrocartilage disc. Okay? So then you have this triangular fibrocartilage complex. Then you have the joint between the carpals. You have the row proximal of carpal bones, then you have the distal row of carpals, and then you have intercarpal joints. And those are basically just gliding joints. And then what do you call, so you have carpal metacarpal joints. So that's between the distal row of carpals and the metacarpals. Okay. And those are still going to be gliding joints here. Okay. Then, what do you call this joint here? Metacarpal flangel or MCP. Okay. And that one is, these are just simple hinge joints here. Okay. And then this one is, what do you call it? Condyloid, yeah. Because you can do circumduction. It's not quite a ball and socket, it's a condyloid. And so then these are hinge joints here. Okay. And then so these are carpal metacarpals, metacarpal phalangeal joints, or MCP. And then what are these? Interphalangeal joints, and then what do you have to differentiate between the two? Proximal distance. So PIPs and DIPs.
What kind of joint did you say the MCP?
Condyloid. Yeah, these are hinges. I'll have to double check that to be sure, but I'm pretty sure they're condyloid. Actually, I think she's done it. Oh, the metacarpal phalangeal joints on these forefingers are gliding joints, but then this one's a saddle joint. Okay, because you have more motion at the base of your thumb than you do at the base of the metacarpals. Yeah, okay, it is ellipsoid. Metacarpal phalangeal is ellipsoid. Yeah, well, it's bicondyloid. It's tetracondyloid, so I was wrong. It's ellipsoid, not bicondyloid. And then the PIPs and the DIPs are hinge joints. Okay, so if you're going from the carpals are gliding joints, and then from the carpals to the metacarpals are gliding joints as well, except for over here, which is a saddle joint. Then when you go to MCP joints, then those are going to be ellipsoid. And then when you get into the PIPs and DIPs, it's just going to be hinge joints. And then here's more detailed information about the triangulofibrocurtilage complex. So it's a combination of things. It's the disc, plus it's also ligaments that go across it and hold it in place. So you can read some of those things. But basically the issue with it is that you can develop problems in that joint when you're doing things where you're putting pressure on the joint and then rotating with a grinding motion, like say if you're putting in, using a screwdriver a whole bunch, or some kind of a jackhammer or something like that, where you're forcing it into ulnar deviation and then adding some kind of a compression or a rotational component of force to it. And then get into inert tissue, so you have the flexor retinaculum. Basically what that is like a ligamentous type of tissue, and it goes across here and holds all those different tendons in place. You have some on the flexor side, you also have some on the extensor side. And then on the flexor retinaculum, we'll talk in a minute about the carpal tunnel. It's the roof of the carpal tunnel. And then you have the pisohamate ligament. Because you have the flexocarpal ulnaris, this muscle, this tendon here, it inserts onto the pisiform. And then you have the pisiform and the pisohamate ligament, which goes from the pisiform to the hamate. It's kind of a continuation of that force, right? When this muscle contracts, that ligament continues that force and pulls this down.